All right, so Kristen, here is that chart that we did. You heard me call out those numbers too. So you can see your back teeth, you did have some little spots of bleeding, but your front teeth look really good. So looking at this chart as a whole, where do you think you're at with this?
Well, I did hear some 4s, so I think I'm here.
Yes, you're exactly right. You do have some areas in your back teeth where you're having an infection in your bone. And the consequence of that is that it could progressively get worse over time. But the good news is we have a way to treat this, especially since we're catching it so early. It's a non-surgical approach to fixing your problem. So you're right here in this level where you have a couple 4s in all of your back teeth. And so we don't want this getting any worse, so it's important that we treat it now. So just those areas that we have 4s, we're going to clean those areas out for you. We just flush all that bacteria out. You'll be comfortable the entire time. So after we clean out just those 4mm areas, we're going to clean out all of the bacteria all over your mouth to get just all of it out. Then we're also going to we're going to put some varnish on your teeth. That's going to help with any sensitivity you may have afterwards, just because we are cleaning your teeth out so well. And then we're going to give you a gel to take home that's going to be really soothing and help strengthen those tissues. We're also going to give you a Sonicare toothbrush. Have you ever had one before?
No.
Yeah, it's an electric toothbrush and you're really going to love it. I'm going to show you how to use it.
Great.
And so you'll know all the instructions then. And then the other part of this is looking at the risk factors that could be contributing to this disease that you have. Do you have any of these?
Well, I do smoke.
Yeah, we talked about that earlier. I know
Yeah.
you're trying to quit, so after we do this, it's really important that you don't smoke afterwards because that's only going to delay your healing process.
Okay.
And this gel that we're going to give you is actually going to help because when you smoke, it dries out your gum tissues a lot and it doesn't let them, it just doesn't, this gel that we're going to give you is going to help build up those gum tissues again.
Oh, great.
Yes. Then also the mouth is the passageway to the body. So everything that you put in your mouth also has a lot of systemic links to it. So just some things that might happen. I know your family history we talked about earlier. They do have a history of high blood pressure. So by treating this now, there's a good chance that you're going to stay away from those things just because it does play a role in it.
Great.
So your prognosis at this time is really good. I think once we treat it and you come in for your regular appointments, then you'll be good. You don't have any surgery at this time needed, and no extractions are needed this time either. Just the risk of non-treatment would be that your disease would progress, and that's what we want to avoid. But we don't need a referral at this time or anything like that. We can treat it all here for you. So we're probably going to block out 2.5 hours for this, just so we can get all of that bacteria out of your gums. You won't be at any discomfort at all. And I'm going to go ahead and run up to the front desk to see what your estimated insurance benefits are for this cleaning. But today we're just going to clean the tops of your teeth and get like a normal cleaning we would, just the part that's outside your gums. Do you have any questions about any of this?
No, I'm good.
Okay,